Welcome back, everyone. Today, we're diving into 7 strange signs your kidneys are crying for help. Between work, errands, and everything in between, life gets busy and we barely stop to think about what's happening inside our bodies. But did you know your body has its own way of waving a red flag when something isn't right? Your kidneys are no exception. Early stages of chronic kidney disease, or CKD, are often silent, with no obvious symptoms and no warning bells. By the time most people notice something's wrong, a part of kidney function could already be lost. Ignoring these subtle signs can lead to severe complications, including heart issues or even end-stage kidney disease. But if you know what to look for, you can catch these early signs and take action before things spiral out of control. So, stick around until the end of this video to learn how to give your kidneys the care they deserve. And don't forget to show some love. You can like this video, subscribe to our channel, and stay tuned for more tips to keep your body in tip-top shape. Let's jump in. 7. Foamy urine. The way your urine looks can give you important clues about your health, especially your kidneys. Foamy urine is characterized by persistent layers of small to medium bubbles that don't go away quickly when you flush. On the other hand, a single layer of larger bubbles that quickly disappear is considered normal. The foam is often linked to a protein called albumin, which has a soap-like effect that reduces surface tension, causing bubbles to form. Albumin is also the same protein found in eggs, which is why foamy urine can resemble the foam you see when scrambling eggs. Persistent foamy urine is worth paying attention to because it may indicate protein in the urine, a condition known as proteinuria, an early sign of kidney disease. When your kidneys are damaged, they can't filter properly, allowing proteins like albumin to leak into the urine. If foamy urine happens occasionally, it could just be due to dehydration or the speed or force of urination. But if you notice foamy urine consistently, it's a good idea to see your doctor. They might recommend a urinalysis to check for protein levels and assess your kidney function. 6. Blood in urine. Seeing blood in your urine, even if it's only detectable under a microscope, could mean your kidneys aren't filtering properly. This is often linked to something called glomerular hematuria, which happens when red blood cells leak through the kidney's filtration system into your urine. It's like a tiny crack in the system letting things through that shouldn't be there. In microscopic hematuria, you can't see the blood with the naked eye. However, in macroscopic hematuria, you can see the blood with your eyes. It may appear red or pink in the toilet bowl. Recent studies show that even small, persistent amounts of blood in the urine could signal a risk for kidney disease if it's ignored. And if the red blood cells become dysmorphic, meaning oddly shaped, it's a sure sign the problem is starting in the kidneys. Now, your doctor might just keep an eye on you with regular urine checks over a few months if your blood pressure and kidney function seem normal. If it doesn't go away, you may need a kidney ultrasound or tests. If you have high blood pressure, abnormal test results, or a family history of kidney problems, your doctor might recommend a kidney biopsy to get to the root of the issue. Blood in your urine can be easy to ignore, especially if you don't feel any different. But catching this early could save your kidney function and a lot of stress down the line. 5. Fatigue. It's not just about being tired. It's the kind of exhaustion that makes even simple tasks feel like climbing a mountain. Imagine feeling completely wiped out after doing something as simple as folding laundry or walking a short distance. If this sounds familiar, you're not alone. About 70% of CKD patients experience fatigue, and for some, it's severe enough to disrupt their daily lives. When your kidneys aren't working properly, waste products stay in your blood instead of being flushed out. This buildup can leave you feeling sluggish and drained, even when you've done nothing physically demanding. In addition to this, your kidneys produce a hormone called erythropoietin, which helps your body make red blood cells. When kidney function declines, and so does red blood cell production, leading to anemia. Without enough red blood cells to carry oxygen, your body's energy levels drop. The good news is that there are ways to manage CKD-related fatigue and improve your energy. Your doctor might prescribe medications or iron supplements to boost your red blood cell levels. So, if you're dealing with extreme fatigue, don't brush it off. Pay attention to what your body's telling you. 4. Trouble sleeping. 80% of people on dialysis struggle with sleep problems. Sleep complaints are quite common among those with kidney disease, especially in the advanced stages. One of the most reported issues is constant daytime sleepiness. But why does this happen? When your kidneys aren't working properly, toxins that should leave your body in urine start building up in your blood. This can leave you tossing and turning at night. There's also a connection between kidney disease, obesity, and sleep apnea, which is a condition where your breathing repeatedly stops and starts while you sleep. Sleep apnea is more common in people with kidney disease than in the general population. A study even dug deeper into these connections. It found that sleep-disordered breathing, SDB, was positively linked to the different CKD stages. Sleep problems got worse as kidney function declined. Even people in the early stages of kidney disease had noticeably poorer sleep quality and used sleep medications more often than people without kidney disease. What's interesting is that age, gender, and even body weight play a role too. For example, older people and women were more likely to experience poor sleep, but the decline in kidney function itself was an independent factor. So, what does this all mean for you? If you're battling poor sleep and you have kidney issues, it's not something to brush off. Sleep problems aren't just frustrating, they can seriously affect your overall health and energy levels. 3. Frequent urination. First, let's clear up some confusion. Frequent urination simply means needing to go to the bathroom more often than usual, but polyuria refers to passing an abnormally large volume of urine in a short period. While the two might sound similar, they're not the same. The number of times people urinate daily can vary widely depending on how much liquid you drink, your bladder size, and personal habits. Generally, most adults urinate about 5 to 6 times a day and maybe once at night. But if you find yourself running to the bathroom constantly, especially at night, which is a condition called nocturia, it's worth investigating. But frequent urination isn't just a kidney issue. It could also point to other health issues like a urinary tract infection or an enlarged prostate in men. The tricky part is that if your kidneys can't excrete all the extra water, you might develop a condition called hyponatremia, where your sodium levels drop too low. Either way, if frequent urination starts disrupting your life, whether it's waking you up at night or leaving you constantly thirsty, it's time to talk to your doctor. 2. Dry and itchy skin. If you have kidney disease, your skin might become so dry that it feels rough and scaly, almost like sandpaper. It can also feel tight or crack easily. Some may even develop fish-like scales. In some cases, these skin issues can even be the first noticeable clue that something's going on with your kidneys. If you're dealing with extremely dry skin, it could be linked to advanced kidney disease, especially for those on dialysis or awaiting a kidney transplant. With dry skin comes the dreaded itchiness, a symptom that's not only common in advanced kidney disease, but can range from mildly annoying to completely disrupting your daily life. You might feel itchy all the time, or it could come and go. The itch can be isolated to one area or spread across most of your body. This dry, itchy skin often comes from mineral and bone disease, a condition that goes hand in hand with advanced kidney disease. When your kidneys stop keeping the right balance of minerals and nutrients in your blood, your skin starts to react, and not in a good way. If you're noticing these skin symptoms, we know you may think it's not serious, but don't ignore them. Talk to your doctor to figure out the cause and find the right treatment plan. 1. Poor appetite. This is not the same as skipping a meal because you're busy or uninterested. It's a persistent lack of desire to eat that can seriously impact your health. Normally, your body has hormones that tell you when you're hungry and when you're full. In CKD, these signals get disrupted, making you feel full or disinterested in food even when your body needs nutrients. Nutrient deficiencies can develop, leaving your body without the vitamins and minerals it needs to function. If you're struggling with appetite loss, instead of 3 large meals, try eating smaller portions more often. If medications are affecting your appetite or taste, your doctor might be able to adjust them. These symptoms might show up when kidney damage has already progressed, but remember that they're not exclusive to kidney issues. They could point to other conditions too. That's why it's necessary to check in with your doctor if you notice any of them. That's it for today. If you found this video helpful, don't forget to like, subscribe to our channel, and stay tuned for more tips to keep your health on point. See you next time.